I'll tell you why half knowledge is dangerous. So we had this patient who was seen by some other doctor who knew that the treatment of prolactinoma is cabergoline and not surgery, but he didn't know how to identify a prolactinoma, or rather he didn't know the difference between a prolactinoma and a mildly elevated prolactin value because of stalk effect in a non-functional pituitary adenoma. I'll tell you what exactly happened. So 2 years back, there was a lady who started having amenorrhea and also milk discharge from her breast. So initial days there were no real vision symptoms, but on evaluation the prolactin was around 250 or so, and MRI showed a large pituitary adenoma. So what the doctor thought, he thought that this is a prolactinoma, but this is not a prolactinoma. Hormones in the range of 200 to 300 is because of stalk effect in a non-functional pituitary adenoma. Now what exactly is stalk effect, we'll come to that later. So what did he do? He started cabergoline. Fine, that's right. But what he told her is that this cabergoline will take care of the tumor and you don't need anything else in the future. As a result, what happened? The cabergoline kept on reducing the prolactin level, which mind you was mildly elevated because of the stalk effect, and her symptoms subsided. So she got back her periods, the milk discharge from the breast stopped, but without she realizing, the tumor kept growing inside, and she was told that nothing else needs to be done, so she didn't bother to do the MRI also. And as you know, people don't usually realize the vision loss they have with pituitary adenoma, because it is the peripheral vision which goes first before they even realize they have lost half their vision. So 2 years later, when she finally realized that she's losing her vision, evaluation was done. She had developed complete bitemporal hemianopia, and the MRI showed boom, even bigger pituitary adenoma sitting there. So what exactly happened? So this was a non-functional pituitary adenoma, not a prolactinoma, but because it pressed on the pituitary stalk, prevented the inhibitory effect of the dopamine, and hence prolactin mildly elevated. So on giving cabergoline, prolactin came down, but it had no effect on the tumor. If it was a prolactinoma, the prolactin value would have been in the range of 2000, 3000, 4000, etc., etc. So mind you, prolactin value in the range of 200, 300 is not suggestive of prolactinoma. It is because of stalk effect. So the treatment of choice in her was operation, which should have been done 2 years back, but unfortunately it was not done. She lost half her vision.